Good evening, everybody. A warm welcome to everybody tonight for this unique presentation on low-level laser therapy. Now, to give you some background, because you'll hear so many laser programs and whatnot, but to give you some background about me, I've been using lasers since 1988. So pretty much when lasers were not even cool, Ron Kaminer was using lasers at the University of Buffalo School of Dental Medicine. And back then, I was using lasers to irradiate hamster cheek pouches. And what we would do is we would inject cancer into hamster cheek pouches and then irradiate them with a carbon dioxide laser and then look at the effects. Now, unbeknownst to me back then, we were never cutting out those lesions. We were just hitting them with energy to see what happens. And back then, we weren't talking about low-level laser therapy, but in essence, my research really ended up being partly due to the fact on low-level laser therapy, because we monitored bacteremias and things like that, and I published articles in the Journal of Oral Maxillofacial Surgery and abstracts as well, and so we kind of had a clue about low-level laser therapy back then, but without really knowing what that actually was. But tonight, I'm going to share with you some principles about low-level laser therapy, and you're all going to get an idea of what I would call laser voodoo actually does and how it can benefit your patients. For those that aren't going to ask me a question here tonight, the best place to get a hold of me is on Instagram. So please friend me at Vino Dentino. And if you friend me on Instagram at Vino Dentino, that is where I'll be most responsive to questions. I get DMs all the time. I respond very, very quickly. Or if you just want to become a friend to learn about dental technology and fine Napa wine, well, that's the place to be anyway. So friend me at Vino Dentino. So let's talk about low-level laser therapy. Low-level laser therapy is a term that you may hear associated with certain lasers in dental medicine. Another term for low-level laser therapy is cold laser therapy or photobiomodulation. So these three things all mean the same thing. And in essence, we're going to use a laser to make bad cells behave like good cells. Now, we're not going to use that laser to cut anything. We're going to transmit the energy to some form of a target tissue, and that target will absorb that energy. So keep in mind that if you see in literature, you see an article, you see a lecture about photobiomodulation, or you see something about low-level laser therapy or cold laser therapy, it is all the same thing. It's exactly the same term. So when we talk about low-level laser therapy, there's been studies going back till 1985. So I just said to you that I've used lasers since 88. Well, there's studies going back to 1985 on the biomedical effects of laser application. So even back then, there was thoughts that laser energy can be used in a fashion other than just to cut something. Now, for those that want to learn more, this is one of the Bibles, the Gospels of low-level laser therapy. It is called Laser Therapy by Jan Turner and Lars Hode. This book is packed with the science behind cold laser therapy. It also talks about cold laser therapy in many specialties of medicine. And there is also a full chapter plus dedicated to dentistry. Now, the reality is that dental cold laser therapy is typically used for therapeutic fashion. That's where we're going to use cold laser therapy. We're going to use it to make bad cells, whatever those bad cells are doing, whether they're causing pain or inflammation or swelling or any of those things, we're going to use the low-level laser to make bad cells behave like good cells. So when can we use cold laser therapy? So if you look at the list, this is only a short list, but the list is pretty much endless. First of all, we can use it as a minimally invasive way for the treatment of recurrent aptostomatitis and traumatic ulcers. We can also use it for the reduction of oral edema. It can be used as a post-operative analgesic following periodontic, oral surgery, anodontic, implant surgery, and perio procedures to substantially reduce pain, swelling, inflammation, and to improve healing and the rapidity of healing. You can also use it for the treatment of recurrent intraoral and labial herpes. Also, it can be used for the management of inflammatory conditions, such as erosive lichen planus or desquamative gingivitis. It can be used to reduce pain from orthodontics. As we all know, the first few days, whether it's Invisalign or active wire therapy, there is some discomfort to the patient as teeth begin to move. Well, we can use a low-level laser to reduce that pain and make the process more comfortable. It's also great for the management of temporomandibular disorders. And besides all these things, very often anyone who knows low-level laser therapy are finding ways to use it on themselves. Elbows, knees, hips, joints. It's off-label, but if you know the science and you know what it does, you can use it for a variety of treatments to reduce inflammation. So this is just facts from the literature. 80% of patients respond positively to low-level laser therapy. Now, this is interesting because, you could use a laser in a low-level way and not see anything happen. There won't be any heat. There won't be any pain when it's done. The patient may not feel anything. They may feel, if they say they feel something, they might say they feel, well, I feel some weirdness or an electric current or something like that. But very often, once you're done with treatment, the patient will say, you know what, that feels better, especially if it's TMJ pain, which is a very common use, or orthodontic pain. Post-surgical pain, you may not feel right away because the patient is likely numb, so they're not going to actually have the ability to sense. But if you trust the science, and if you trust the laser, and if you trust the process, you know that when you're applying laser energy post-surgery, you're doing something positive to that patient. Is it subjective? Yes, because let's say that patient comes the next day and says, on post-op, and said, Doc, you know what? I'm really doing pretty well. Doesn't really hurt. And you use the laser on them the day before. Well, if you didn't use the laser, maybe they'd still feel the same way. There's no way to know that. But when the studies were done and have been done, they're able to see not only biological changes, but also able to elicit response from patients on immediate post-op, how they feel in certain situations. So what's happening? There was an article published in the Journals of Clinical Medicine in 2020. Laser irradiation can induce a photobiomodulation effect on cells and tissues, contributing to a directed modulation of cell behaviors, enhancing the process of tissue repair. So we are repairing tissue. Photobiomodulation, or as we go forward in this program, we'll nickname it or call it PBM, also known as LLLT, low-level laser therapy, can induce cell proliferation. It can enhance stem cell differentiation. And it's basically a non-invasive method that contributes to pain relief and reduction of inflammation, parallel to the enhanced healing and tissue repair process. So it works with the body to heal quicker, better, and faster. Here's what we do know from the studies, that the biostimulation effect of laser irradiation results in physiological, metabolic, and functional changes in living microorganisms. They can actually see what's happening at the cellular level. Very often they will see increased ATP, increased RNA and DNA, increased mitochondrial fusion and fission. Everything happened at the cellular level after irradiation with a low-level laser. Here's what else they know from the science. What is also known is we get to see a primary effect, an effect that happens at the primary site. That means masculine muscles inflamed, TMJ-wise, and you hit it with the laser and they feel better afterwards. That's the primary site, and this is dose and application dependent. But what we also observe from low-level laser therapy is something that's called a secondary effect, an effect that happens in the entire system due to substances emitted into circulation from the targeted cells. So when you hit that masseter, and the patient feels better, those targeted cells also emit substances into the bloodstream and into the lymphatic system that help reduce systemic inflammation. And what the studies continue to show, that the likely mechanism of positive effect is due to cells in the tissue subjected to light produce substances that circulate in those blood and lymphatics. That is likely why we see this secondary effect. Now, when they realized this was happening, they said, you know what? We're going to try to confirm this. So they did a study where they used a CO2 laser, which produced a widespread systemic effect. But CO2 can only penetrate tissue a fraction of a millimeter. So even though the primary was only a fraction of a millimeter or a millimeter deep, in that study, they saw widespread systemic effects. And that led to the hypothesis that PBM works through a small primary, but much larger secondary response as it uses its influence on the body. Now, effects are dependent on a number of things. They're dependent on the laser wavelength. They're dependent on the size of the dose. They're dependent on the level of the power density, how much energy is being delivered in a period of time to that target tissue. The effects are dependent, the primary effects, on depth of penetration. And then, of course, treatment frequency and total number of treatments. Tonight, we're going to focus on diode lasers with photobiomodulation. But to a certain extent, every laser exhibits some form of PBM. Even while they cut, they're creating some sort of photobiomodulation at the site. One of the studies that I did back in '88 with the CO2 showed when cutting with the CO2 laser, there was a decreased bacteremia in the entire body as opposed to scalpel and electrosurge. Well, this makes sense now because we always hypothesized it was only because the CO2 laser killed bacteria. But it was also because now I know that it's also because there was a biostimulatory effect that when those cells were irradiated, properties were released into the lymphatics to decrease that bacteremia. And the same properties, the same cuts, with the CO2 laser and electrosurge showed a much higher bacteremia in the body. So this slide is critically important. The effects are dependent on a variety of things, and you need to understand that all these things are important. Now, as we scroll to the bottom of the slide and we talk about treatment frequency and total number of treatments, The rule of thumb with low-level laser therapy is the less, the better, meaning you want to treat and then you want to go ahead and you want to treat and then you want to go ahead and let the energy do its thing. So if you're treating somebody, let's say for a TMJ, you don't want to hit them every single day, multiple times a day. You want to treat them for a few minutes, let that patient go home, skip a day, treat them in another few days if need be, let the patient go home, so on and so forth. So you don't want to treat them in high doses back to back. Again, any laser will give you some biostimulation at the right dose. Diodes in general penetrate fairly deep, and understanding that you're going to get a nice dose at the primary place, at the primary site, and you'll also get a dose or a impact on the secondary site. So now let's talk about the size of the dose. Well, how do you know? So for years, we didn't know, or we had some idea, depending on the laser. There were joule counters. There was the ability to measure the amount of energy on certain lasers, but with diodes, it has been very, very difficult to do. Now, with ultra-dense Gemini laser, and that's the laser we're going to focus on today, there is actually a PBM calculator on the website. So you don't have to calculate it. All you got to do is hit the treatment site, and it's going to tell you how much energy on the Gemini laser to put into that particular area. Now, you don't have to calculate it, but you should document it so that you have an understanding for a number of reasons. Number one, let's say it's TMJ pain and you get them better by treating them with a diode laser. Well, if you do that and they come back a year later, you want to know what that dose was right away. You don't have to guess. Could you go back to the website? Yes, of course you could. But at least you have it documented so you know. The other thing is that even though you're not going to do harm with something like this, because you can't do harm. Let's say the patient was litigious and they wanted to blame something on you. You have a measurement of the number of joules. You know you're within a safe zone. You have it documented. You want to make sure you're documented and you put it into the record. Now, we spoke about power density a little bit, how important that is. But what affects power density? Again, power density is the amount of energy delivered to that tissue in joules. Joules is a measurement of laser energy in that particular time period. Well, what affects power density are a number of things. Number one, the size of the tip. How wide or how small a tip will affect power density. How far you are from the target tissue. Do you want to be touching it 1 millimeter away or 5 millimeters away? And then, of course, the tissue type. Is it fibrotic tissue? Is it pigmented tissue? Is it inflamed tissue? Is there granulation tissue? Diode energy intraorally is absorbed by pigment and hemoglobin. So let's say you have an inflamed perio pocket and you decide you want to treat it with low-level laser therapy, not with active therapy with a tip in the pocket. Well, still, because that energy is going to penetrate the pocket, because the energy will penetrate that pocket, it's going to be more rapidly absorbed in a granulation tissue type pocket because it's pigmented, as opposed to a regular 3 millimeter pocket on somebody that smokes where the tissue could be fibrotic. So again, diodes like pigment and hemoglobin intraorally. And if we, lack of a better term, laser or zap that area with a diode laser, you're going to have very strong power density in that area. So how often do we treat? Well, listen, I think it depends on what you're treating, but the reality is for most things, we're going to treat them 2 to 4 times per week with a day off in between treatment. And we know from the studies that moderate energy more frequently is better than high energy less frequently. So we're going to use a moderate energy, and we're going to do it a few days a week versus hitting it with a high amount and doing it once a week. Now, again, what are we treating? We could be treating TMJ pain. We could be treating Bell's palsy, which is an off-label use, but again, it works with diode lasers. We could be treating apical pain after an implant placement. We could be treating a surgical site after an apical, or surgical site after periosurgery, or an oral surgical procedure where you extract a tooth. Well, in those situations, we'll treat them. And the goal there for treatment is to improve healing and decrease pain, with decreased pain being the primary goal. We'll likely treat those patients until pain is relieved. Same thing with TMJ. Same thing with an implant pain or a perio pain or an ortho pain. We're likely going to treat them till their discomfort goes away. Not necessarily treat them till their oral surgical wound is totally healed. Could you? Yes, of course you could. But at some point, you're being superfluous. So you're not going to do any damage. But the goal here is to get them as comfortable as you can, or as pain-free as you can, in as fast a period of time as you can. Now, the UltraDent Evo, that's the name of the laser, has 3 different tip sizes. One is a 25 millimeter tip. You see how that tip is very large. It's an extra oral tip, and the end of that tip has a little spacer on it. So that's about 3 millimeters. You place it right on the soft tissue, as you'll see in a little bit, but you're not putting the laser right on it. The 3 millimeter just gives you a little bit of a space and allowing the energy to penetrate directionally and properly. You also have a 7 millimeter intraoral tip and a 3 millimeter intraoral tip. What's nice about the Gemini Evo is the minute you go into the laser section for low-level laser therapy or pain, low-level pain therapy, these energies you see at the bottom, 1 watt or 0.3, are automatically calibrated for you in the laser. And the only thing you have to adjust is amount of time, how much time you want to treat that area for. Typically, we'll treat for 1 minute with a minute break and do it 4 or 5 times. But you can look at your joules and it'll give you a guidance. But that's what I use as my guide. 1 minute treatment, 4 or 5 times with a minute rest in between. So it's a minute treatment, a minute rest, a minute treatment, a minute rest. And we'll do that and then send the patient home and likely bring them back 2 days later. So the calculator allows us to see how much energy we're putting into the patient. And for the most part, we can treat most cases with 4 joules per centimeter squared, between 4 joules centimeter squared and 30 joules per centimeter squared, well in the safety zone for treatment with diode lasers. The 7 millimeter tip, the most that you can, or the most joules that is suggested, is 44 joules, because it has a high power density. It's only a 7 millimeter tip, so the energy is high. You may get some heat generated with that. That's, again, all preset for you within the website and the laser. Let's talk about depth of penetration. As opposed to the CO2 that I shared with you earlier, that only penetrates a tenth of a millimeter or so, diodes tend to penetrate fairly deeply. If we agree that we are dependent on blood vessels to promote and carry substances, we need somewhat of a decent penetration and a good amount of energy. Now, again, we got some penetration even with the CO2, but you have to also understand that compared to a diode, a CO2 is a much more powerful laser than a diode. So we need and we want the penetration in order to get the secondary response for the diode. So we're definitely going to get it as a definitely going to get a primary response. So again, I'm going to treat them 2 to 4 times per week. If I'm doing a TMJ situation, I'll start treating them Monday, Wednesday, try to gauge how they feel. So on Monday, I'm always going to say to them, if they come in and I tell them, tell me on a scale of 1 to 10, how much pain do you have? Well, they'll tell me they have an 8. After I treat them, how much pain? Well, it's better. Maybe it's a 4. Great. They come back on Wednesday. How much pain now? It was a 4. Maybe it's a 5, but yesterday was good. It was a 3. So we know we're still fluctuating around 4. I'll treat them again. How do you feel? Oh, this is much better now. I would say a 1 or a 2. Send them home, bring them back Friday, 3rd time in the week. How do you feel? I'm pretty good right now. So I'll go ahead and treat them one more time. And if they're good, they're done. I'm not going to excessively put laser energy into them because at the same time, more can be a problem. So remember, when it comes to lasers in general, the less energy, the better. So again, depending on what you're treating, in the beginning, I'll see them every other day. But after a number of treatments, there's a cumulative effect of this kind of stuff. So I may give them a break for a week and then bring them back. It's been shown to be beneficial. It's not necessary, but that's kind of the way I do it. And part of the issue is with low-level laser therapy is while there is a lot of science, the science is not crystal clear. We know it helps. We know it works. We kind of think we know why it works. But I can't tell you that if someone has TMJ pain, here's the exact regimen for TMJ pain, or here's the exact regimen for wound healing. There's too much variability for that exact regimen. The thing with diodes is they don't have to be perfect to produce a good biological response. We get penetration, they're going to now be, you're not going to have release into the bloodstream, into the circulatory system, and you will get a response. This was the original Gemini PBM attachment. If you notice, that's not fitting in anybody's mouth. It's a 25 millimeter tip. It is meant for extraoral use only. Now, this is great for TMJ pain. Off-label, you could use it for Bell's palsy, maybe lingual paresthesias. It's great for improving circulation post-surgery. Treat from the outside in. You'll get penetration even to the soft tissue. If you hit it on the cheek or on the chin, if you did lower anterior work, you will get some energy. And that was the philosophy until Ultradent launched in the last year and a half or whatever it was, the 2 new intraoral tips where you now can get real close to the surgery site or intraorally. Remember power density, the amount of energy delivered to the area in a period of time. Can I get energy on this big wide tip? If the person had mucogingival surgery on number 25, could I put this on the chin and get penetration to that surgical site through the lower lip? Absolutely, you could. Is it better if I can pull the lip back slightly and use the 7 millimeter tip intraorally? Absolutely, power density. So again, here are those tips. The tiny tip, great for an apicoectomy type situation. The 7 millimeter tip, great for post-implant surgery, which I'll show you in a little bit. Let's give you some video demos so you can kind of see what these tips are, how these tips are. Hopefully they'll play smooth on your computer and you'll be able to see.
So today we're going to talk about low-level laser therapy or photobiomodulation. The EVO comes with three different tips for photobiomodulation. This tip is an extraoral tip, ideal for TMJ. The spacer, which basically just screws on like that, and the tip, which basically just screws on like this, can easily be placed outside the face for anybody with muscular pain or TMJ pain. It also comes with two brand new tips, the 7mm tip and the 3mm tip. The 7mm tip can be used intraorally, as we'll demonstrate in a second, after surgery or oral surgery to reduce postoperative pain, inflammation, and improved healing. And finally, the 3mm tip can be used in situations like apical surgery, where we want a pinpoint spot, or even for class 5 erosions to reduce sensitivity. So we will demo that in the mouth in a second. The Evo has specific settings, as you can see here, for pain relief, with the associated tip being demarcated here on the laser. So if I scroll down on these tips,
7mm tip active.
the unit will actually tell you exactly which tip is being used. And by moving the arrows up or down now, instead of adjusting power, we're adjusting seconds and how many seconds we want to use this tip for. And as you can see here, right now I have a 35, 37, 40-second time to use the 7mm tip intraorally, which I will demonstrate for you in a moment. The photobiomodulation tip on the Evo is ideal for the assistance of treatment of TMJ pain and facial pain. Photobiomodulation, or low-level laser therapy, allows laser energy to transfer from the tip through the skin down to the cellular level to reduce inflammation, reduce pain, and make basically bad cells behave like good cells. The spacer, which we've screwed on here, just separates that tip from the skin. I'm going to place it over here because Ashley is having some TMJ pain, and all I'm going to do now is place the laser in active mode, and I've set it just for 15 seconds for a demonstration. You see a very wide aiming beam, and I'm going to basically put it here. The patient's not going to feel anything. They might feel a little electric type feeling, but it's really just the energy doing its thing. They'll feel the vibration of the laser. That's just the laser with a haptic sensation. And I'm going to move it around her TMJ and her muscles for a few seconds each, just for the treatment.
Now keep in mind that what I would do if it was TMJ pain, I would now probably treat her a minute on, a minute off, masseter around the joint, other masseter around the other joint, temporalis. I would treat all these muscles for probably at least a couple of minutes. So this could be a 15, 20-minute treatment for this patient in order to get them to feel better. And they will feel a difference right away. And when they come back 48 hours later, they'll definitely feel a big difference. Notice once again, that tip was on Ashley's face. Now, that energy didn't burn a hole in her face. What did it do? It was transmitted through the skin till it got to the muscle that was in pain, and then it was absorbed by that muscle. Very key to understanding low-level laser therapy, the concept of transmission and absorption. So this is interesting. This was a throat cancer patient treated in Brazil that had radiation to the head and neck. He was treated with the 25mm tip, the tip that I just showed you. Twice a day, 24 seconds each, 10 points per lesion. Here's what he looked like in a very short period of time, about a week after. Look at the incredible healing on this. This is the power of low-level laser therapy. You can call it laser voodoo, call it what you want, but this is the incredible, incredible power of this type of energy. Let's show you the intraoral tip.
The The 7mm tip would be ideal for post-surgical treatment to remove pain or reduce pain following oral surgery and improve lymphatics and improve blood flow to reduce inflammation. So we're going to go here intraorally. Ashley had an implant placed not long ago, and we're going to go right by our implant and place the tip literally on the soft tissue. You could even be a millimeter away. And what we're doing is just putting laser energy into the site to reduce inflammation.
So if you notice, I went right down to the base of that implant and I fired the laser. That was just a demo. It was a very short firing. But what I would do there is I would treat it a minute on the buccal, then a minute on the lingual, and give a minute break. And then a minute on the buccal, a minute on the lingual, and give a minute break. And do that for 5 minutes total. So 5-minute total treatment time on each side. And then send the patient home. And usually that's enough to get them to feel better. So post-extraction treatment. So ideally you want to treat for 3 minutes with 30-second intervals and 10 seconds of rest. So I give them a rest treat them for 3 minutes, 30-second intervals. You could treat them if you want to up to a minute intervals. You don't want to do more than that. Give them a little bit of rest and then go back again. You should see quicker coagulation, less discomfort, and also quicker healing.
The umbrella retractor by Ultradent is ideal, especially when you want to do a pinpoint situation. So here we have the 3mm tip, and the 3mm tip can be used for pinpoint pain reduction. So if someone had an apicoectomy and you were going to go up here, or someone you wanted to do reduce sensitivity, or even at following treatment for operative or crown and bridge, all these things will help improve inflammation with the tip. You can see here, imagine this patient had an apicoectomy. I'm going to have Ashley close halfway for me so I can retract, and all I'm going to do is place that tip right here near the apical part of the tooth. And what you will see is just the 3mm tip will have even a little bit of extension of the energy laterally on either side. And I'll move it around as well to different locations here on the tissue. And the patient is not anesthetized and they don't feel anything. And that's the demo of the 3mm tip.
So where would I use that 3mm tip? It'll work well for desensitization, class 5 desensitization. You try it on a class 5, you'll be surprised. Again, you don't see anything happen, but you blow air prior, blow air after, ask them to gauge the level of discomfort, 0 to 10 before, 0 to 10 after, and you'll be blown away with the results on how much less sensitive they are. So these class 5 erosions, it's going to work great. I've never done this, but there are some studies to show that you can hit the tooth prior to cementing crowns, inlays, and onlays and get sensitivity reduction, and also prior to restoring deep lesions. So this is a 2016 study, application of diode laser in the treatment of dental hypersensitivity. Within the scope of this conducted study, laser therapy has provided extremely safe and effective results in the treatment of cervical dentin hypersensitivity. Yes, it was a European study. You could tell by the word dentine, but it does work for people that are sensitive, because sometimes you'll apply your glumas, they won't work, and you don't necessarily want to put a composite in there if it's totally clean. So attempting to treat with a laser can yield very positive results in a very short period of time. So this is science. This is not Ryan Kaminer making things up. I try to support things with science. So here's a number of articles. Low-level laser therapy, when used as an adjunct with conventional root canal treatment, showed acceleration of the healing process of the periapical lesion. LLLT has a positive effect on modulating the immune response for favorable healing. The effect of PBM therapy after endodontic treatment showed a significant decrease in the prevalence of post-op pain. That was another study. The results confirmed that PBM have beneficial effects in the early phase of the healing process, playing a role in modulation of bradykinin, epidermal growth factor, and vascular epidermal growth factor in gingival clavicular fluid levels. Both groups had significant clinical improvement over control, but there was no significant difference between them, only a trend for the PBM group. The overall results of the study suggest a potential benefit of PBM in conjunction with scaling and root planing in treating chronic periodontitis. So the potential of combining the effect of PBM, and notice I use the term PBM and LLLT interchangeably, so the potential effect of combining PBM with scaling and root planing shows in this study that it may be beneficial. Clinical research showing low-level laser therapy in accelerating orthodontic tooth movement. The cumulative tooth movement over 28 days was significantly higher in the laser group than the control group. Within the parameter settings used in this study, LLLT could to some extent lead to changes in bone metabolism, which could accelerate orthodontic tooth movement. So a number of different ways that low-level laser therapy can be used. Low-level laser therapy in the management of muscle fatigue caused after long endodontic procedure. 44 patients complaining of reduced mouth opening and pain while opening after a long endo procedure. So in the study, low-level laser therapy was applied while patients of the control group did not get anything. When both groups were compared, a statistically significant reduction with fatigue was found in the laser group. So a huge difference there as well. And that's a recent study, just now, literally May of 2023. So what I was saying is that we know this works, and more science is being investigated, and you will see more literature about this in the not so distant future because of the benefits with basically no side effects. So now I'm going to talk to you about an off-label procedure. This is not something that the ultradent diode is approved to be used for, but I knew it would work. Now, I would say, this is going back now a year and a half or so, I had a patient that developed Bell's palsy, and I'm not trying to be political at all, but one of the things I did notice after COVID was a substantial increase in Bell's palsy, more than I saw in the first 30 years of practice, I saw in the last 2 or 3. I don't know if it's due to the vaccine. I don't know if it's due to the disease. I'm not here to speculate, but I've seen a bunch. And a former Pilates instructor of mine, I used to do Pilates, who was a patient, called me one day and said, "Did I remember years ago you told me you treated somebody for Bell's palsy?" And I treated someone for Bell's palsy back 15 years ago with a diode laser. And I'm like, "Yeah." She goes, "My dad had all of a sudden got Bell's palsy. He's been on steroids and antiviral meds for 10 days plus, and he's not getting better. Would you mind seeing him?" I'm like, "Okay, I have no problem seeing him," because I understood the science and I knew the literature. Even though this was an off-label use, off-label means it's not approved, but if you know the science, know the literature, you're a dentist, you can do what you think is right. So this was a study on Bell's palsy, complete and fast recovery from idiopathic facial paralysis using laser photobiomodulation. Bell's palsy treated with photobiomodulation in an adolescent. It was a rare case report and review. Photobiomodulation was effective to treat Bell's palsy. The patient got better quicker. This was Kurt. Kurt got Bell's palsy 10 days ago. He's been on steroids and antivirals with no response as of yet. He's seeking treatment options. He is miserable. He can't close his eye. You could see the droop on his face. Now, we do know that Bell's palsy does resolve in 75% of cases on their own, but resolution could take 6 months in certain situations, and there's still going to be the 25% that don't resolve. So I told Kurt I could try. I can't promise, but I figured we'd give it a whirl. Here's what Kurt looks like. And if you see, and if you know the innervation of Bell's palsy, you have to be able to treat Kurt all the way up from the forehead, all the way down to the chin. It has to go from top to bottom, because the nerves run from that upper forehead down mid-face, under the nose, around the side of the nose, the ala, and then near the lip, of course, and down to the chin. And this is Kurt right here. You see the droopy face here in this picture, and this is exactly Kurt, except Kurt could not close his eye. So here's what we did. Twice a week, 6 to 8 minutes application time in total. Now, I had glasses on him for part of the procedure, but because I had to go under the eye, because if we go back to the innervation, if I go real close below the eye here, I'm not going to be able to get there with the glasses. Then I had to remove the glasses and protect his eye. I did 1 minute application twice a week, 6 to 8 minute application time total of the face, just moving it around every 15, 20 seconds. Now, I'm going to show you this video, and you may be able to see this, maybe not. When I show this in the lecture, it's hard to see. But I knew day one I was going to be able to help Kurt. This is his first appointment. Because if you look closely, somewhere around here, mid-video, when I treated him up here near his forehead, we saw a little excitation, a little jump of the tissue. And I knew that if I was here with this tip, and I could have excitation here, that I was going to stimulate that nerve and I was going to help Kurt. Right about here, we should see it. Right there, the little twitch, if you saw it right around here, he twitched while I was up there. And that told me that I was going to be able to help Kurt. Notice I'm either on the soft tissue or even a millimeter away, moving around every few seconds. My assistant even said to me, "Oh my God, look at that. His face just twitched." So we went back and we reported it right after. Again, I covered his eye with the gauze. So I treated Kurt like this every week. Here was week 2. Week 3, getting better. Week 4, still can't close his eye yet, but he's getting better. Week 5, he now can open his eye wider. He's more level. And week 6, Kurt can close his eye. Now, the question always is, what do you charge for these things? Well, with Kurt, I didn't charge anything. This is a patient service. And with low-level laser therapy, it depends on what I'm doing. If it's for TMJ pain, I'll bill it as a palliative treatment. But it just all depends. It could be part of a protocol or part of treatment. It's not covered by insurance, so it's not billable to insurance. But we do bill patients in certain situations. Here, we were happy to help Kurt, to change Kurt's life, because this was truly life-changing for him. So what I tried to do tonight was kind of give you a brief overview of photobiomodulation, kind of pique your thought process a little bit and get you to say, hey, there's some things we can do. For sure, when you do PBM, you go into what I would call uncharted territory. Not a lot of people are doing it. You're not going to do harm. You got to believe in it. But you can, when it works, it will work miracles. It's non-invasive, so why not give it a try? It's safe. Pacemakers, anything like that, it's totally safe to do. So there's no reason not to try it and give these patients a chance. So with that, I left about 10 minutes or so for question and answer. I'm going to go to the Q&A. Savannah asked first question. So a patient who smokes, would they see less benefits from a diode laser than a patient that has pigment and hemoglobin? Well, that's a crooked question, Savannah, because the answer in theory is yes. But if you are able to increase your exposure time and you are able, in this laser, everything is preset as far as energy. So if you were going to treat someone with loads of pigment for 6 minutes, you maybe treat the person who's a smoker with fibrotic tissue for 12 minutes. So they wouldn't necessarily see less benefits because you'd increase exposure time. Remember, we spoke about power density. And one of the ways to change that is to change how much energy is going in. So if you increase the exposure time, more energy over a period of time is going to go in, and they could see exactly the same benefits. Ocean, thanks for the question. I think I just answered that, but I'll go through. The question is, how do you charge for these visits? And again, sometimes I do, sometimes I don't. If it's TMJ, I may just give a case fee or build it into the fee for a night guard or so on and so forth. It could be any of those things. But again, if it's going to build to insurance, I'll put it in as palliative treatment. Can the 25 millimeter tip be used for other sites, such as shoulder muscle pain or neck muscle pain for dentists? The answer is, if you're going to use it on yourself, it is off label because we're not physicians. But the answer is yes, you can use it on shoulders, neck pains, things like that. So I got a question about side effects and contraindications. I mean, the only contraindication I would really say is someone who's pregnant. Not that you can cause any harm, you just don't do anything on anybody that's pregnant. In regards to side effects, I've never ever seen a side effect because we're putting low level energy, so low level laser energy, into the soft tissue, and I've never seen a negative side effect with using LLLT. Have I used a 7 millimeter tip to treat a dry socket? I have used it to treat post-oral surgery. I haven't seen a dry socket in a very long time in my practice, and that could be why. How do you decide about the duration of exposure intervals? Well, again, if you go to the website with Evo, it'll show you how much energy to put in, and you'll know exactly from that. If you don't have that laser and you have a different company's laser, you have to follow their protocols for using that laser. Does it help with soft tissue periodontal grafting procedures? The answer is, again, Misty, I don't do that, but there's no reason it shouldn't help that, because again, what it's doing is promoting healing. It's promoting reduction of inflammation. So logic would say it would help very, very much. Do I go over the hair and scalp with doing PBM for the temporalis? Yes, absolutely. And it will reach the muscle because it's a diode and you'll get deep penetration. Could the laser be used to treat tinnitus? That's interesting. I actually tried, it didn't work. Doesn't mean it can't, but I actually tried and it did not work. Dr. Rosenthal, hi there, says to me, why do I not wear safety glasses? The answer is, I should be wearing safety glasses. But again, when I'm pointing that tip at the tissue and not pointing it at my eye, I understand the energy and the science, knowing I'm not going to hurt myself. But someone who's starting out with it should definitely be wearing safety glasses. I would like to thank all of you for joining me tonight. Enjoy your holiday weekend, and I hope you have learned a bit tonight about lasers. Have a great night.